Section 29 of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The arteries of the lower extremity. The artery which supplies the greater part of the lower extremity is the direct continuation of the external iliac. It runs as a single trunk from the inguinal ligament to the lower border of the popliteas, where it divides into two branches, the anterior and posterior tibial. The upper part of the main trunk is named the femoral, the lower part the popliteal. The femoral artery, A femoralis. The femoral artery begins immediately behind the inguinal ligament, midway between the anterior superior spine of the ilium and the symphysis pubis, and passes down the front and medial side of the thigh. It ends at the junction of the middle with the lower third of the thigh, where it passes through an opening in the adductor magnus to become the popliteal artery. The vessel at the upper part of the thigh lies in front of the hip joint. In the lower part of its course it lies to the medial side of the body of the femur, and between these two parts, where it crosses the angle between the head and body, the vessel is some distance from the bone. The first 4 centimeters of the vessel is enclosed, together with the femoral vein, in a fibrous sheath, the femoral sheath. In the upper third of the thigh the femoral artery is contained in the femoral triangle, Scarpa's triangle, and in the middle third of the thigh in the adductor canal, Hunter's canal. The femoral sheath, crural sheath, is formed by a prolongation downward behind the inguinal ligament of the fasciae which line the abdomen, the transversalis fascia being continued down in front of the femoral vessels and the iliac fascia behind them. The sheath assumes the form of a short funnel, the wide end of which is directed upward, while the lower narrow end fuses with the fascial investment of the vessels about 4 centimeters below the inguinal ligament. It is strengthened in front by a band termed the deep crural arch. The lateral wall of the sheath is vertical and is perforated by the lumboinguinal nerve. The medial wall is directed obliquely downward and lateralward, and is pierced by the great saphenous vein and by some lymphatic vessels. The sheath is divided by 2 vertical partitions which stretch between its anterior and posterior walls. The lateral compartment contains the femoral artery, and the intermediate the femoral vein, while the medial and smallest compartment is named the femoral canal, and contains some lymphatic vessels and a lymph gland embedded in a small amount of areolar tissue. The femoral canal is conical and measures about 1.25 centimeters in length. Its base, directed upward and named the femoral ring, is oval in form, its long diameter being directed transversely and measuring about 1.25 centimeters. The femoral ring is bounded in front by the inguinal ligament, behind by the pectineus, covered by the pectineal fascia, medially by the crescentic base of the lacunar ligament, and laterally by the fibrous septum on the medial side of the femoral vein. The spermatic cord in the male and the round ligament of the uterus in the female lie immediately above the anterior margin of the ring, while the inferior epigastric vessels are close to its upper and lateral angle. The femoral ring is closed by a somewhat condensed portion of the extraperitoneal fatty tissue named the septum femorale, Crural Septum, the abdominal surface of which supports a small lymph gland and is covered by the parietal layer of the peritoneum. The septum femorale is pierced by numerous lymphatic vessels passing from the deep inguinal to the external iliac lymph glands, and the parietal peritoneum immediately above it presents a slight depression named the femoral fossa. The femoral triangle, trigonum femorale, Scarpa's triangle, corresponds to the depression seen immediately below the fold of the groin. Its apex is directed downward, and the sides are formed laterally by the medial margin of the sartorius, medially by the medial margin of the adductor longus, and above by the inguinal ligament. The floor of the space is formed from its lateral to its medial side by the iliacus, psoas major, pectineus, in some cases a small part of the adductor brevis, and the adductor longus, and it is divided into 2 nearly equal parts by the femoral vessels, which extend from near the middle of its base to its apex, the artery giving off in this situation its superficial and profunda branches, the vein receiving the deep femoral and great saphenous tributaries. On the lateral side of the femoral artery is the femoral nerve dividing into its branches. Besides the vessels and nerves, this space contains some fat and lymphatics. The adductor canal, Canalus adductorius, Hunter's canal, is an aponeurotic tunnel in the middle third of the thigh, extending from the apex of the femoral triangle to the opening in the adductor magnus. It is bounded in front and laterally by the vastus medialis, behind by the adductores longus and magnus, and is covered in by a strong aponeurosis which extends from the vastus medialis across the femoral vessels to the adductores longus and magnus. Lying on the aponeurosis is the sartorius muscle. The canal contains the femoral artery and vein, the saphenous nerve, and the nerve to the vastus medialis. Relations of the femoral artery. In the femoral triangle the artery is superficial. In front of it are the skin and superficial fascia, the superficial subinguinal lymph glands, the superficial iliac circumflex vein, the superficial layer of the fascia lata, and the anterior part of the femoral sheath. The lumboinguinal nerve courses for a short distance within the lateral compartment of the femoral sheath, and lies at first in front and then lateral to the artery. Near the apex of the femoral triangle the medial branch of the anterior femoral cutaneous nerve crosses the artery from its lateral to its medial side. Behind the artery are the posterior part of the femoral sheath, the pectineal fascia, the medial part of the tendon of the psoas major, the pectineus, and the adductor longus. The artery is separated from the capsule of the hip joint by the tendon of the psoas major, from the pectineus by the femoral vein and profunda vessels, and from the adductor longus by the femoral vein. The nerve to the pectineus passes medialward behind the artery. On the lateral side of the artery, but separated from it by some fibers of the psoas major, is the femoral nerve. The femoral vein is on the medial side of the upper part of the artery, but is behind the vessel in the lower part of the femoral triangle. In the adductor canal the femoral artery is more deeply situated, being covered by the integument, the superficial and deep fasciae, the sartorius, and the fibrous roof of the canal. The saphenous nerve crosses from its lateral to its medial side. Behind the artery are the adductores longus and magnus. In front and lateral to it is the vastus medialis. The femoral vein lies posterior to the upper part and lateral to the lower part of the artery. Peculiarities. Several cases are recorded in which the femoral artery divided into two trunks below the origin of the profunda, and became reunited near the opening in the adductor magnus, so as to form a single popliteal artery. One occurred in a patient who was operated upon for popliteal aneurysm. A few cases have been recorded in which the femoral artery was absent, its place being supplied by the inferior gluteal artery which accompanied the sciatic nerve to the popliteal fossa. The external iliac in these cases was small and terminated in the profunda. The femoral vein is occasionally placed along the medial side of the artery throughout the entire extent of the femoral triangle, or it may be split so that a large vein is placed on either side of the artery for a greater or lesser distance. Collateral circulation. After ligature of the femoral artery, the main channels for carrying on the circulation are the anastomoses between 1. The superior and inferior gluteal branches of the hypogastric, with the medial and lateral femoral circumflex and first perforating branches of the profunda femoris. 2. The obturator branch of the hypogastric, with the medial femoral circumflex of the profunda. 3. The internal pudendal of the hypogastric, with the superficial and deep external pudendal of the femoral. 4. The deep iliac circumflex of the external iliac, with the lateral femoral circumflex of the profunda, and the superficial iliac circumflex of the femoral, and 5. The inferior gluteal of the hypogastric, with the perforating branches of the profunda. Branches. The branches of the femoral artery are superficial epigastric, superficial iliac circumflex, superficial external pudendal, deep external pudendal, muscular, profunda femoris, highest genicular. The superficial epigastric artery, A. epigastrica superficialis, arises from the front of the femoral artery about 1 centimeter below the inguinal ligament, and passing through the femoral sheath and the fascia cribrosa turns upward in front of the inguinal ligament, and ascends between the two layers of the superficial fascia of the abdominal wall nearly as far as the umbilicus. It distributes branches to the superficial subinguinal lymph glands, the superficial fascia, and the integument. It anastomoses with branches of the inferior epigastric and with its fellow of the opposite side. The superficial iliac circumflex artery, A. circumflexa ilium superficialis, the smallest of the cutaneous branches, arises close to the preceding, and piercing the fascia lata runs lateralward, parallel with the inguinal ligament, as far as the crest of the ilium. It divides into branches which supply the integument of the groin, the superficial fascia, and the superficial subinguinal lymph glands. anastomosing with the deep iliac circumflex, the superior gluteal and lateral femoral circumflex arteries. The superficial external pudendal artery, A. pudenda externa superficialis, superficial external pudic artery, arises from the medial side of the femoral artery, close to the preceding vessels, and after piercing the femoral sheath and fascia cribrosa courses medialward across the spermatic cord, or round ligament in the female, to be distributed to the integument on the lower part of the abdomen, the penis and scrotum in the male, and the labium majus in the female, anastomosing with branches of the internal pudendal. The deep external pudendal artery, A. pudenda externa profunda, deep external pudic artery, more deeply seated than the preceding, passes medialward across the pectineus and the adductor longus muscles. It is covered by the fascia lata, which it pierces at the medial side of the thigh, and is distributed in the male to the integument of the scrotum and perineum, in the female to the labium majus. Its branches anastomose with the scrotal or labial branches of the perineal artery. Muscular branches, rami musculares, are supplied by the femoral artery to the sartorius, vastus medialis, and adductores. The profunda femoris artery, A. profunda femoris, deep femoral artery, is a large vessel arising from the lateral and back part of the femoral artery, from 2 to 5 centimeters below the inguinal ligament. At first it lies lateral to the femoral artery, it then runs behind it and the femoral vein to the medial side of the femur, and passing downward behind the adductor longus, ends at the lower third of the thigh in a small branch, which pierces the adductor magnus and is distributed on the back of the thigh to the hamstring muscles. The terminal part of the profunda is sometimes named the fourth perforating artery. Relations. Behind it, from above downward, are the iliacus, pectineus, adductor brevis, and adductor magnus. In front it is separated from the femoral artery by the femoral and profunda veins above, and by the adductor longus below. Laterally, the origin of the vastus medialis intervenes between it and the femur. Peculiarities. This vessel sometimes arises from the medial side and more rarely from the back of the femoral artery. But a more important peculiarity from a surgical point of view is that relating to the height at which the vessel arises. In 3/4 of a large number of cases it arose from 2.25 to 5 centimeters below the inguinal ligament. In a few cases the distance was less than 2.25 centimeters, more rarely opposite the ligament, and in one case above the inguinal ligament from the external iliac. Occasionally the distance between the origin of the vessel and the inguinal ligament exceeds 5 centimeters. Branches. The profunda gives off the following branches: lateral femoral circumflex, medial femoral circumflex, perforating, muscular. The lateral femoral circumflex artery, A. circumflexa femoris lateralis, external circumflex artery, arises from the lateral side of the profunda, passes horizontally between the divisions of the femoral nerve, and behind the sartorius and rectus femoris, and divides into ascending, transverse, and descending branches. The ascending branch passes upward beneath the tensor fasciae lati to the lateral aspect of the hip, and anastomoses with the terminal branches of the superior gluteal and deep iliac circumflex arteries. The descending branch runs downward behind the rectus femoris upon the vastus lateralis, to which it gives offsets. One long branch descends in the muscle as far as the knee and anastomoses with the superior lateral genicular branch of the popliteal artery. It is accompanied by the branch of the femoral nerve to the vastus lateralis. The transverse branch, the smallest, passes lateralward over the vastus intermedius, pierces the vastus lateralis, and winds around the femur just below the greater trochanter, anastomosing on the back of the thigh with the medial femoral circumflex, inferior gluteal, and first perforating arteries. The medial femoral circumflex artery, A. circumflexa femoris medialis, internal circumflex artery, arises from the medial and posterior aspect of the profunda, and winds around the medial side of the femur, passing first between the pectineus and psoas major, and then between the obturator externus and the adductor brevis. At the upper border of the adductor brevis it gives off 2 branches. One is distributed to the adductores, the gracilis and obturator externus, and anastomoses with the obturator artery. The other descends beneath the adductor brevis to supply it and the adductor magnus. The continuation of the vessel passes backward and divides into superficial, deep, and acetabular branches. The superficial branch appears between the quadratus femoris and upper border of the adductor magnus. and anastomosis with the inferior gluteal, lateral femoral circumflex, and first perforating arteries. Crucial anastomosis. The deep branch runs obliquely upward upon the tendon of the obturator externus and in front of the quadratus femoris toward the trochanteric fossa, where it anastomoses with twigs from the gluteal arteries. The acetabular branch arises opposite the acetabular notch, and enters the hip joint beneath the transverse ligament in company with an articular branch from the obturator artery. It supplies the fat in the bottom of the acetabulum and is continued along the round ligament to the head of the femur. The perforating arteries, usually 3 in number, are so named because they perforate the tendon of the adductor magnus to reach the back of the thigh. They pass backward close to the linea aspera of the femur, under cover of small tendinous arches in the muscle. The first is given off above the adductor brevis, the second in front of that muscle, and the third immediately below it. The first perforating artery, A perforans prima, passes backward between the pectineus and adductor brevis. Sometimes it perforates the latter. It then pierces the adductor magnus close to the linea aspera. It gives branches to the adductores brevis and magnus, biceps femoris, and gluteus maximus, and anastomoses with the inferior gluteal, medial and lateral femoral circumflex, and second perforating arteries. The second perforating artery, A perforans secunda, larger than the first, pierces the tendons of the adductores brevis and magnus, and divides into ascending and descending branches which supply the posterior femoral muscles, anastomosing with the first and third perforating. The second artery frequently arises in common with the first. The nutrient artery of the femur is usually given off from the second perforating artery. When 2 nutrient arteries exist, they usually spring from the first and third perforating vessels. The third perforating artery, A perforans tertia, is given off below the adductor brevis. It pierces the adductor magnus and divides into branches which supply the posterior femoral muscles, anastomosing above with the higher perforating arteries, and below with the terminal branches of the profunda and the muscular branches of the popliteal. The nutrient artery of the femur may arise from this branch. The termination of the profunda artery, already described, is sometimes termed the fourth perforating artery. Numerous muscular branches arise from the profunda. Some of these end in the adductores, others pierce the adductor magnus, give branches to the hamstrings, and anastomose with the medial femoral circumflex artery and with the superior muscular branches of the popliteal. The highest genicular artery, A genus suprema, anastomotica magna artery, arises from the femoral just before it passes through the opening in the tendon of the adductor magnus, and immediately divides into a saphenous and a musculo-articular branch. The saphenous branch pierces the aponeurotic covering of the adductor canal and accompanies the saphenous nerve to the medial side of the knee. It passes between the sartorius and gracilis, and piercing the fascia lata, is distributed to the integument of the upper and medial part of the leg, anastomosing with the medial inferior genicular artery. The musculo-articular branch descends in the substance of the vastus medialis and in front of the tendon of the adductor magnus to the medial side of the knee, where it anastomoses with the medial superior genicular artery and anterior recurrent tibial artery. A branch from this vessel crosses above the patellar surface of the femur, forming an anastomotic arch with the lateral superior genicular artery, and supplying branches to the knee joint. End of section 29.
Of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Marianne Coleman Hipkins. The Popliteal Fossa, the Popliteal Artery. 6b. The Popliteal Fossa. Boundaries. The popliteal fossa, or space, is a lozenge-shaped space at the back of the knee joint. Laterally, it is bounded by the biceps femoris above and by the plantaris and the lateral head of the gastrocnemius below. Medially, it is limited by the semitendinosus and semimembranosus above, and by the medial head of the gastrocnemius below. The floor is formed by the popliteal surface of the femur, the oblique popliteal ligament of the knee joint, the upper end of the tibia, and the fascia covering the popliteus. The fossa is covered in by the fascia lata. Contents. The popliteal fossa contains the popliteal vessels, the tibial and the common peroneal nerves, the termination of the small saphenous vein, the lower part of the posterior femoral cutaneous nerve, the articular branch from the obturator nerve, a few small lymph glands, and a considerable quantity of fat. The tibial nerve descends through the middle of the fossa, lying under the deep fascia, and crossing the vessels posteriorly from the lateral to the medial side. The common peroneal nerve descends on the lateral side of the upper part of the fossa, close to the tendon of the biceps femoris. On the floor of the fossa are the popliteal vessels, the vein being superficial to the artery and united to it by dense areolar tissue. The vein is a thick-walled vessel, and lies at first lateral to the artery, and then crosses it posteriorly to gain its medial side below. Sometimes it is double, the artery lying between the two veins, which are usually connected by short transverse branches. The articular branch from the obturator nerve descends upon the artery to the knee joint. The popliteal lymph glands, 6 or 7 in number, are embedded in the fat. One lies beneath the popliteal fascia, near the termination of the external saphenous vein, another between the popliteal artery and the back of the knee joint, while the others are placed at the sides of the popliteal vessel. Arising from the artery and passing off from it at right angles are its genicular branches. 6c. The popliteal artery. A. Poplitea. The popliteal artery is the continuation of the femoral and crosses through the popliteal fossa. It extends from the opening in the adductor magnus at the junction of the middle and lower thirds of the thigh, downward and lateralward, to the intercondyloid fossa of the femur, and then vertically downward to the lower border of the popliteus, where it divides into anterior and posterior tibial arteries. Relations. In front of the artery from above downward are the popliteal surface of the femur, which is separated from the vessel by some fat, the back of the knee joint and the fascia covering the popliteus. Behind, it is overlapped by the semimembranosus above and is covered by the gastrocnemius and plantaris below. In the middle part of its course the artery is separated from the integument and fasciae by a quantity of fat, and is crossed from the lateral to the medial side by the tibial nerve and the popliteal vein, the vein being between the nerve and the artery and closely adherent to the latter. On its lateral side above are the biceps femoris, the tibial nerve, the popliteal vein, and the lateral condyle of the femur. Below, the plantaris and the lateral head of the gastrocnemius. On its medial side above are the semimembranosus and the medial condyle of the femur. Below the tibial nerve, the popliteal vein, and the medial head of the gastrocnemius. The relations of the popliteal lymph glands to the artery are described above. Peculiarities in point of division. Occasionally the popliteal artery divides into its terminal branches, opposite the knee joint. The anterior tibial, under these circumstances, usually passes in front of the popliteus. Unusual branches. The artery sometimes divides into the anterior tibial and peroneal, the posterior tibial being wanting or very small. Occasionally it divides into 3 branches, the anterior and posterior tibial and peroneal. Branches. The branches of the popliteal artery are muscular, superior, crural; cutaneous, medial superior genicular; lateral superior genicular; middle genicular, medial inferior genicular; lateral inferior genicular. The superior muscular branches, 2 or 3 in number, arise from the upper part of the artery and are distributed to the lower parts of the adductor magnus and hamstring muscles, anastomosing with the terminal part of the profunda femoris. The crural arteries, A.A. ceralis, inferior muscular arteries, are 2 large branches which are distributed to the gastrocnemius, soleus, and plantaris. They arise from the popliteal artery opposite the knee joint. The cutaneous branches arise either from the popliteal artery or from some of its branches. They descend between the 2 heads of the gastrocnemius, and piercing the deep fascia, are distributed to the skin of the back of the leg. One branch usually accompanies the small saphenous vein. The superior genicular arteries, A.A. genus superioris, superior articular arteries, 2 in number, arise one on either side of the popliteal and wind round the femur immediately above its condyles to the front of the knee joint. The medial superior genicular runs in front of the semimembranosus and semitendinosus, above the medial head of the gastrocnemius, and passes beneath the tendon of the adductor magnus. It divides into 2 branches, one of which supplies the vastus medialis, anastomosing with the highest genicular and medial inferior genicular arteries. The other ramifies close to the surface of the femur, supplying it and the knee joint, and anastomosing with the lateral superior genicular artery. The medial superior genicular artery is frequently of small size, a condition which is associated with an increase in the size of the highest genicular. The lateral superior genicular passes above the lateral condyle of the femur, beneath the tendon of the biceps femoris, and divides into a superficial and a deep branch. The superficial branch supplies the vastus lateralis, and anastomoses with the descending branch of the lateral femoral circumflex and the lateral inferior genicular arteries. The deep branch supplies the lower part of the femur and knee joint, and forms an anastomotic arch across the front of the bone, with the highest genicular and the medial inferior genicular arteries. The middle genicular artery, A. genu media, azygos articular artery, is a small branch arising opposite the back of the knee joint. It pierces the oblique popliteal ligament and supplies the ligaments and synovial membrane in the interior of the articulation. The inferior genicular arteries, A.A. genu inferioris, inferior articular arteries, 2 in number, arise from the popliteal beneath the gastrocnemius. The medial inferior genicular first descends along the upper margins of the popliteus, to which it gives branches. It then passes below the medial condyle of the tibia, beneath the tibial collateral ligament, at the anterior border of which it ascends to the front and medial side of the joint, to supply the upper end of the tibia and the articulation of the knee, anastomosing with the lateral inferior and medial superior genicular arteries. The lateral inferior genicular runs lateralward along the head of the fibula to the front of the knee joint, passing in its course beneath the lateral head of the gastrocnemius, the fibular collateral ligament, and the tendon of the biceps femoris. It ends by dividing into branches which anastomose with the medial inferior and lateral superior genicular arteries, and with the anterior recurrent tibial artery. The anastomosis around the knee joint, around and above the patella, and on the contiguous ends of the femur and tibia, is an intricate network of vessels forming a superficial and a deep plexus. The superficial plexus is situated between the fascia and skin around the patella, and forms 3 well-defined arches, one above the upper border of the patella in the loose connective tissue over the quadriceps femoris. The other 2, below the level of the patella, are situated in the fat behind the ligamentum patellae. The deep plexus, which forms a close network of vessels, lies on the lower end of the femur and upper end of the tibia, around their articular surfaces, and sends numerous offsets into the interior of the joint. The arteries which form this plexus are the 2 medial and the 2 lateral genicular branches of the popliteal, the highest genicular, the descending branch of the lateral femoral circumflex, and the anterior recurrent tibial. End of section number 30. Recording by Marianne Coleman Hipkins. www.thisvoiceforyou.com.
Of Gray's Anatomy, Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The anterior tibial artery, Arteria tibialis anterior. The anterior tibial artery commences at the bifurcation of the popliteal, at the lower border of the popliteus, passes forward between the 2 heads of the tibialis posterior, and through the aperture above the upper border of the interosseous membrane, to the deep part of the front of the leg. It here lies close to the medial side of the neck of the fibula. It then descends on the anterior surface of the interosseous membrane, gradually approaching the tibia. At the lower part of the leg it lies on this bone, and then on the front of the ankle joint, where it is more superficial, and becomes the dorsalis pedis. Relations. In the upper 2/3 of its extent, the anterior tibial artery rests upon the interosseous membrane, in the lower third upon the front of the tibia and the anterior ligament of the ankle joint. In the upper third of its course it lies between the tibialis anterior and the extensor digitorum longus. In the middle third between the tibialis anterior and extensor hallucis longus. At the ankle it is crossed from the lateral to the medial side by the tendon of the extensor hallucis longus, and lies between it and the first tendon of the extensor digitorum longus. It is covered in the upper 2/3 of its course by the muscles which lie on either side of it, and by the deep fascia; in the lower third by the integument and fascia, and the transverse and cruciate crural ligaments. The anterior tibial artery is accompanied by a pair of venae comitantes, which lie one on either side of the artery. The deep peroneal nerve, coursing through the lateral side of the neck of the fibula, comes into relation with the lateral side of the artery shortly after it has reached the front of the leg. About the middle of the leg the nerve is in front of the artery. At the lower part it is generally again on the lateral side. Peculiarities in size. This vessel may be diminished in size, may be deficient to a greater or less extent, or may be entirely wanting, its place being supplied by perforating branches from the posterior tibial, or by the perforating branch of the peroneal artery. Course. The artery occasionally deviates toward the fibular side of the leg, regaining its usual position at the front of the ankle. In rare instances, the vessel has been found to approach the surface in the middle of the leg, being covered merely by the integument and fascia below that point. Branches. The branches of the anterior tibial artery are: posterior tibial recurrent, fibular, anterior tibial recurrent, muscular, anterior medial malleolar, anterior lateral malleolar. The posterior tibial recurrent artery, arteria recurrens tibialis posterior, an inconstant branch, is given off from the anterior tibial before that vessel passes through the interosseous space. It ascends in front of the popliteus, which it supplies, and anastomoses with the inferior genicular branches of the popliteal artery, giving an offset to the tibio-fibular joint. The fibular artery is sometimes derived from the anterior tibial, sometimes from the posterior tibial. It passes lateralward around the neck of the fibula through the soleus, which it supplies, and ends in the substance of the peroneus longus. The anterior tibial recurrent artery, arteria recurrens tibialis anterior, arises from the anterior tibial as soon as that vessel has passed through the interosseous space. It ascends in the tibialis anterior, ramifies on the front and sides of the knee joint, and assists in the formation of the patellar plexus by anastomosing with the genicular branches of the popliteal and with the highest genicular artery. The muscular branches, rami muscularis, are numerous. They are distributed to the muscles which lie on either side of the vessel, some piercing the deep fascia to supply the integument, others passing through the interosseous membrane, and anastomosing with branches of the posterior tibial and peroneal arteries. The anterior medial malleolar artery, arteria malleolaris anterior medialis, internal malleolar artery, arises about 5 cm above the ankle joint, and passes behind the tendons of the extensor hallucis longus and tibialis anterior to the medial side of the ankle, upon which it ramifies, anastomosing with branches of the posterior tibial and medial plantar arteries, and with the medial calcaneal from the posterior tibial. The anterior lateral malleolar artery, Arteria malleolaris anterior lateralis, external malleolar artery, passes beneath the tendons of the extensor digitorum longus and peroneus tertius, and supplies the lateral side of the ankle, anastomosing with the perforating branch of the peroneal artery, and with ascending twigs from the lateral tarsal artery. The arteries around the ankle joint anastomose freely with one another and form networks below the corresponding malleoli. The medial malleolar network is formed by the anterior medial malleolar branch of the anterior tibial, the medial tarsal branches of the dorsalis pedis, the posterior medial malleolar and medial calcaneal branches of the posterior tibial, and branches from the medial plantar artery. The lateral malleolar network is formed by the anterior lateral malleolar branch of the anterior tibial, the lateral tarsal branch of the dorsalis pedis, the perforating and the lateral calcaneal branches of the peroneal, and twigs from the lateral plantar artery. The arteria dorsalis pedis. Dorsalis pedis artery. The arteria dorsalis pedis, the continuation of the anterior tibial, passes forward from the ankle joint along the tibial side of the dorsum of the foot to the proximal part of the first intermetatarsal space, where it divides into two branches, the first dorsal metatarsal and the deep plantar. Relations. This vessel, in its course forward, rests upon the front of the articular capsule of the ankle joint, the talus, navicular, and second cuneiform bones, and the ligaments connecting them, being covered by the integument, fascia, and cruciate ligament, and crossed near its termination by the first tendon of the extensor digitorum brevis. On its tibial side is the tendon of the extensor hallucis longus. On its fibular side, the first tendon of the extensor digitorum longus, and the termination of the deep peroneal nerve. It is accompanied by two veins. Peculiarities in size. The dorsal artery of the foot may be larger than usual to compensate for a deficient plantar artery, or its terminal branches to the toes may be absent, the toes then being supplied by the medial plantar. Or its place may be taken altogether by a large perforating branch of the peroneal artery. Position. This artery frequently curves lateralward, lying lateral to the line between the middle of the ankle and the back part of the first interosseous space. Branches. The branches of the arteria dorsalis pedis are lateral tarsal, medial tarsal, arcuate, first dorsal metatarsal, deep plantar. The lateral tarsal artery, Arteria torsea lateralis, tarsal artery, arises from the dorsalis pedis, as that vessel crosses the navicular bone. It passes in an arched direction lateralward, lying upon the tarsal bones, and covered by the extensor digitorum brevis. It supplies this muscle and the articulations of the tarsus, and anastomoses with branches of the arcuate, anterior lateral malleolar, and lateral plantar arteries, and with the perforating branch of the peroneal artery. The medial tarsal arteries, Arteriae torsiae medialis, are 2 or 3 small branches which ramify on the medial border of the foot, and join the medial malleolar network. The arcuate artery, Arteria arcuata, metatarsal artery, arises a little anterior to the lateral tarsal artery. It passes lateralward over the bases of the metatarsal bones, beneath the tendons of the extensor digitorum brevis, its direction being influenced by its point of origin, and it anastomoses with the lateral tarsal and lateral plantar arteries. This vessel gives off the second, third, and fourth dorsal metatarsal arteries, which run forward upon the corresponding interossei dorsalis. In the clefts between the toes, each divides into two dorsal digital branches for the adjoining toes. At the proximal parts of the interosseous spaces, these vessels receive the posterior perforating branches from the plantar arch, and at the distal parts of the spaces they are joined by the anterior perforating branches from the plantar metatarsal arteries. The fourth dorsal metatarsal artery gives off a branch which supplies the lateral side of the fifth toe. The first dorsal metatarsal artery, Arteria dorsalis hallucis, runs forward on the first interosseous dorsalis, and at the cleft between the first and second toes divides into two branches, one of which passes between the tendon of the extensor hallucis longus and is distributed to the medial border of the great toe. The other bifurcates to supply the adjoining sides of the great and second toes. The deep plantar artery, ramus plantaris profundus, communicating artery, descends into the sole of the foot between the two heads of the first interosseous dorsalis, and unites with the termination of the lateral plantar artery to complete the plantar arch. It sends a branch along the medial side of the great toe, and is continued forward along the first interosseous space as the first plantar metatarsal artery, which bifurcates for the supply of the adjacent sides of the great and second toes. End of section 31. Of Gray's Anatomy Part 3. This is a Librivox recording. All Librivox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The posterior tibial artery, Arteria tibialis posterior. The posterior tibial artery begins at the lower border of the popliteus, opposite the interval between the tibia and fibula. It extends obliquely downward, and, as it descends, it approaches the tibial side of the leg, lying behind the tibia, and in the lower part of its course is situated midway between the medial malleolus and the medial process of the calcaneal tuberosity. Here it divides beneath the origin of the adductor hallucis into the medial and lateral plantar arteries. Relations. The posterior tibial artery lies successively upon the tibialis posterior, the flexor digitorum longus, the tibia, and the back of the ankle joint. It is covered by the deep transverse fascia of the leg, which separates it above from the gastrocnemius and soleus. At its termination it is covered by the abductor hallucis. In the lower third of the leg, where it is more superficial, it is covered only by the integument and fascia, and runs parallel with the medial border of the tendo calcaneus. It is accompanied by two veins, and by the tibial nerve, which lies at first to the medial side of the artery, but soon crosses it posteriorly, and is in the greater part of its course on its lateral side. Behind the medial malleolus the tendons, blood vessels, and nerve are arranged, under cover of the lacineate ligament, in the following order from the medial to the lateral side. 1. The tendons of the tibialis posterior and flexor digitorum longus lying in the same groove behind the malleolus, the former being the more medial. Next is the posterior tibial artery, with a vein on either side of it, and lateral to the vessels is the tibial nerve. About 1.25 cm nearer the heel is the tendon of the flexor hallucis longus. Peculiarities in size. The posterior tibial is not infrequently smaller than usual, or absent, its place being supplied by a large peroneal artery, which either joins the small posterior tibial artery or continues alone to the sole of the foot. Branches. The branches of the posterior tibial artery are peroneal, nutrient, muscular, posterior medial malleolar, communicating, medial calcaneal. The peroneal artery, Arteria peroneia, is deeply seated on the back of the fibular side of the leg. It arises from the posterior tibial about 2.5 cm below the lower border of the popliteus, passes obliquely toward the fibula, and then descends along the medial side of that bone, contained in a fibrous canal between the tibialis posterior and the flexor hallucis longus, or in the substance of the latter muscle. It then runs behind the tibio-fibular syndesmosis and divides into lateral calcaneal branches which ramify on the lateral and posterior surfaces of the calcaneus. It is covered in the upper part of its course by the soleus and deep transverse fascia of the leg, below by the flexor hallucis longus. Peculiarities in origin. The peroneal artery may arise 7 to 8 cm below the popliteus, or from the posterior tibial high up, or even from the popliteal. Its size is more frequently increased than diminished, and then it either reinforces the posterior tibial by its junction with it, or altogether takes the place of the posterior tibial in the lower part of the leg and foot, the latter vessel only existing as a short muscular branch. In those rare cases where the peroneal artery is smaller than usual, a branch from the posterior tibial supplies its place, and a branch from the anterior tibial compensates for the diminished anterior peroneal artery. In one case the peroneal artery was entirely wanting. Branches. The branches of the peroneal are muscular, nutrient, perforating, communicating, lateral calcaneal. Muscular branches. The peroneal artery, in its course, gives off branches to the soleus, tibialis posterior, flexor hallucis longus, and peronae. The nutrient artery, Arteria nutritia fibulae, supplies the fibula and is directed downward. The perforating branch, Ramus perforans, anterior peroneal artery, pierces the interosseous membrane about 5 cm above the lateral malleolus to reach the front of the leg, where it anastomoses with the anterior lateral malleolar. It then passes down in front of the tibio-fibular syndesmosis, gives branches to the tarsus, and anastomoses with the lateral tarsal. The perforating branch is sometimes enlarged, and takes the place of the dorsalis pedis artery. The communicating branch, Ramus communicans, is given off from the peroneal about 2.5 cm from its lower end, and joins the communicating branch of the posterior tibial. The lateral calcaneal, Ramus calcaneus lateralis, external calcaneal, are the terminal branches of the peroneal artery. They pass to the lateral side of the heel, and communicate with the lateral malleolar, and, on the back of the heel, with the medial calcaneal arteries. The nutrient artery, Arteria nutritia tibiae, of the tibia, arises from the posterior tibial near its origin, and after supplying a few muscular branches, enters the nutrient canal of the bone, which it traverses obliquely from above downward. This is the largest nutrient artery of bone in the body. The muscular branches of the posterior tibial are distributed to the soleus and deep muscles along the back of the leg. The posterior medial malleolar artery, Arteria malleolaris posterior medialis, internal malleolar artery, is a small branch which winds around the tibial malleolus and ends in the medial malleolar network. The communicating branch, Ramus communicans, runs transversely along the back of the tibia about 5 cm above its lower end beneath the flexor hallucis longus, and joins the communicating branch of the peroneal. The medial calcaneal, rami calcaneae medialis, internal calcaneal, are several large arteries which arise from the posterior tibial just before its division. They pierce the laciniate ligament and are distributed to the fat and integument behind the tendo calcaneus and about the heel, and to the muscles on the tibial side of the sole, anastomosing with the peroneal and medial malleolar, and on the back of the heel with the lateral calcaneal arteries. The medial plantar artery, Arteria plantaris medialis, internal plantar artery, much smaller than the lateral, passes forward along the medial side of the foot. It is at first situated above the Adductor hallucis, and then between it and the flexor digitorum brevis, both of which it supplies. At the base of the first metatarsal bone, where it is much diminished in size, it passes along the medial border of the first toe, anastomosing with the first dorsal metatarsal artery. Small superficial digital branches accompany the digital branches of the medial plantar nerve, and join the plantar metatarsal arteries of the first three spaces. The lateral plantar artery, Arteria plantaris lateralis, external plantar artery, much larger than the medial, passes obliquely lateralward and forward to the base of the fifth metatarsal bone. It then turns medialward to the interval between the bases of the first and second metatarsal bones, where it unites with the deep plantar branch of the dorsalis pedis artery, thus completing the plantar arch. As this artery passes lateralward, it is first placed between the calcaneus and abductor hallucis, and then between the flexor digitorum brevis and quadratus plantae. As it runs forward to the base of the little toe, it lies more superficially between the flexor digitorum brevis and abductor digiti quinti, covered by the plantar aponeurosis and integument. The remaining portion of the vessel is deeply situated. It extends from the base of the fifth metatarsal bone to the proximal part of the first interosseous space, and forms the plantar arch. It is convex forward, lies below the bases of the second, third, and fourth metatarsal bones, and the corresponding interossi, and upon the oblique part of the adductor hallucis. Branches. The plantar arch, besides distributing numerous branches to the muscles, integument, and fasciae in the sole, gives off the following branches: Perforating, plantar metatarsal. The perforating branches, rami perforantes, are 3 in number. They ascend through the proximal parts of the second, third, and fourth interosseous spaces, between the heads of the interossi dorsalis, and anastomose with the dorsal metatarsal arteries. The plantar metatarsal arteries, Arteriae metatarsei plantaris, digital branches, are 4 in number, and run forward between the metatarsal bones and in contact with the interossi. Each divides into a pair of plantar digital arteries, which supply the adjacent sides of the toes. Near their points of division, each sends upward an anterior perforating branch to join the corresponding dorsal metatarsal artery. The first plantar metatarsal artery, Arteria princeps hallucis, springs from the junction between the lateral plantar and deep plantar arteries, and sends a digital branch to the medial side of the first toe. The digital branch for the lateral side of the fifth toe arises from the lateral plantar artery near the base of the fifth metatarsal bone. End of section 32.
Section 33 of Gray's Anatomy Part 3. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 3, by Henry Gray. The Veins. Introduction. The veins convey the blood from the capillaries of the different parts of the body to the heart. They consist of 2 distinct sets of vessels, the pulmonary and systemic. The pulmonary veins, unlike other veins, contain arterial blood, which they return from the lungs to the left atrium of the heart. The systemic veins return the venous blood from the body generally to the right atrium of the heart. The portal vein, an appendage to the systemic venous system, is confined to the abdominal cavity and returns the venous blood from the spleen and the viscera of digestion to the liver. This vessel ramifies in the substance of the liver and there breaks up into a minute network of capillary-like vessels, from which the blood is conveyed by the hepatic veins to the inferior vena cava. The veins commence by minute plexuses which receive the blood from the capillaries. The branches arising from these plexuses unite together into trunks, and these, in their passage toward the heart, constantly increase in size as they receive tributaries or join other veins. The veins are larger and altogether more numerous than the arteries, hence the entire capacity of the venous system is much greater than that of the arterial. The capacity of the pulmonary veins, however, only slightly exceeds that of the pulmonary arteries. The veins are cylindrical like the arteries. Their walls, however, are thin, and they collapse when the vessels are empty, and the uniformity of their surfaces is interrupted at intervals by slight constrictions, which indicate the existence of valves in their interior. They communicate very freely with one another, especially in certain regions of the body, and these communications exist between the larger trunks as well as between the smaller branches. Thus, between the venous sinuses of the cranium and between the veins of the neck, where obstruction would be attended with imminent danger to the cerebral venous system, large and frequent anastomoses are found. The same free communication exists between the veins throughout the whole extent of the vertebral canal, and between the veins composing the various venous plexuses in the abdomen and pelvis, for example, the spermatic, uterine, vesical, and pudental. The systemic venous channels are subdivided into three sets, namely, superficial and deep veins and venous sinuses. The superficial veins, cutaneous veins, are found between the layers of the superficial fascia, immediately beneath the skin. They return the blood from these structures and communicate with the deep veins by perforating the deep fascia. The deep veins accompany the arteries and are usually enclosed in the same sheaths with these vessels. With the smaller arteries, as the radial, ulnar, brachial, tibial, peroneal, they exist generally in pairs, one lying on each side of the vessel, and are called venae comitantes. The larger arteries, such as the axillary, subclavian, popliteal, and femoral, have usually only one accompanying vein. In certain organs of the body, however, the deep veins do not accompany the arteries. For instance, the veins in the skull and vertebral canal, the hepatic veins in the liver, and the larger veins returning blood from the bones. Venous sinuses are found only in the interior of the skull, and consist of canals formed by the separation of the two layers of the dura mater. Their outer coat consists of fibrous tissue, their inner of an endothelial layer continuous with the lining membrane of the veins. End of section 33.
Section 34 of Gray's Anatomy, Part 3. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Anatomy of the Human Body, Part 3, by Henry Gray. Pulmonary veins, systemic veins, and veins of the heart. 2. The pulmonary veins. Vena pulmonalis. The pulmonary veins return the arterialized blood from the lungs to the left atrium of the heart. They are 4 in number, 2 from each lung, and are destitute of valves. They commence in a capillary network upon the walls of the air sacs, where they are continuous with the capillary ramifications of the pulmonary artery, and, joining together, form one vessel for each lobule. These vessels, uniting successively, form a single trunk for each lobe, 3 for the right and 2 for the left lung. The vein from the middle lobe of the right lung generally unites with that from the upper lobe, so that ultimately 2 trunks from each lung are formed. They perforate the fibrous layer of the pericardium and open separately into the upper and back parts of the left atrium. Occasionally the 3 veins on the right side remain separate. Not infrequently the 2 left pulmonary veins end by a common opening. At the root of the lung, the superior pulmonary vein lies in front of and a little below the pulmonary artery. The inferior is situated at the lowest part of the hilus of the lung, and on a plane posterior to the upper vein. Behind the pulmonary artery is the bronchus. Within the pericardium their anterior surfaces are invested by the serous layer of this membrane. The right pulmonary veins pass behind the right atrium and superior vena cava, the left in front of the descending thoracic aorta. 3. The systemic veins. The systemic veins may be arranged into 3 groups: the veins of the heart, the veins of the upper extremities, head, neck, and thorax, which end in the superior vena cava, the veins of the lower extremities, abdomen and pelvis, which end in the inferior vena cava. The veins of the heart: coronary sinus, sinus coronaris, VV cordis. Most of the veins of the heart open into the coronary sinus. This is a wide venous channel about 2.25 centimetres in length, situated in the posterior part of the coronary sulcus, and covered by muscular fibres from the left atrium. It ends in the right atrium between the openings of the inferior vena cava and the atrioventricular aperture, its orifice being guarded by a semilunar valve, the valve of the coronary sinus, valve of Fabricius. Tributaries. Its tributaries are the great, small, and middle cardiac veins, the posterior vein of the left ventricle, and the oblique vein of the left atrium, all of which, except the last, are provided with valves at their orifices. 1. The great cardiac vein, vein cordis magna, left coronary vein, begins at the apex of the heart and descends along the anterior longitudinal sulcus to the base of the ventricles. It then curves to the left in the coronary sulcus, opens into the left extremity of the coronary sinus, and reaching the back of the heart, opens into the left extremity of the coronary sinus. It receives tributaries from the left atrium and from both ventricles. 1. The left marginal vein is of considerable size, and ascends along the left margin of the heart. 2. The small cardiac vein, vein cordis parve, right coronary vein, runs in the coronary sulcus between the right atrium and ventricle, and opens into the right extremity of the coronary sinus. It receives blood from the back of the right atrium and ventricle. The right marginal vein ascends along the right margin of the heart and joins it in the coronary sulcus, or opens directly into the right atrium. 3. The middle cardiac vein, vein cordis media, commences at the apex of the heart, ascends to the posterior longitudinal sulcus, and ends in the coronary sinus near its right extremity. 4. The posterior vein of the left ventricle, venus posterius ventricula sinistra, runs on the diaphragmatic surface of the left ventricle to the coronary sinus, but may end in the great cardiac vein. 5. The oblique vein of the left atrium, venus obliquus anthris sinistrae Marshalli, oblique vein of Marshall, is a small vessel which descends obliquely on the back of the left atrium and ends in the coronary sinus near its left extremity. It is continuous above with the ligament of the left vena cava, lig vena cava sinistra, vestigial fold of Marshall, and the 2 structures from the remnant of the left Cuvierian duct. The following cardiac veins do not end in the coronary sinus. 1. The anterior cardiac veins, comprising 3 or 4 small vessels which collect blood from the front of the right ventricle and open into the right atrium. The right marginal vein frequently opens into the right atrium, and is therefore sometimes regarded as belonging to this group. 2. The smallest cardiac veins, veins of Fabricius, consist of a number of minute veins which arise in the muscular wall of the heart. The majority open into the atria, but a few end in the ventricles. End of section 34.
Section 35 of Gray's Anatomy, Part 3. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit librivox.org. Recording by Bologna Times. Anatomy of the Human Body, Part 3, by Henry Gray. Veins of head and neck, veins of exterior of head and face. 3b. The veins of the head and neck. The veins of the head and neck may be subdivided into three groups. 1. The veins of the exterior of the head and face. 2. The veins of the neck. 3. The diploic veins, the veins of the brain, and the Vena Sinuses of the dura mater. The veins of the exterior of the head and face are frontal, superficial temporal, supraorbital, internal maxillary, angular, posterior facial, anterior facial, posterior auricular, occipital. The front vein, venous frontalis, begins on the forehead in a venous plexus which communicates with the frontal branches of the superficial temporal vein. The veins converge to form a single trunk, which runs downward near the middle line of the forehead, parallel with the vein of the opposite side. The two veins are joined at the root of the nose by a transverse branch called the nasal arch, which receives some small veins from the dorsum of the nose. At the root of the nose the veins diverge, and each at the medial angle of the orbit joins the supraorbital vein to form the angular vein. Occasionally the frontal veins join to form a single trunk, which bifurcates at the root of the nose into the two angular veins. The supraorbital vein, venous supraorbitalis, begins on the forehead, where it communicates with the frontal branch of the superficial temporal vein. It runs downward, superficial, to the frontalis muscle, and joins the frontal vein at the medial angle of the orbit to form the angular vein. Previous to its junction with the frontal vein, it sends through the supraorbital notch into the orbit a branch which communicates with the ophthalmic vein. As this vessel passes through the notch, it receives the frontal diploic vein through a foramen at the bottom of the notch. The angular vein, venus angularis, formed by the junction of the frontal and supraorbital veins, runs obliquely downward, on the side of the root of the nose, to the level of the lower margin of the orbit, where it becomes the anterior facial vein. It receives the veins of the ala nasi and communicates with the superior ophthalmic vein through the nasofrontal vein, thus establishing an important anastomosis between the anterior facial vein and the cavernous sinus. The anterior facial vein, venus facialis anterior facial vein, commences at the side of the root of the nose and is a direct continuation of the angular vein. It lies behind the external maxillary facial artery and follows a less tortuous course. It runs obliquely downward and backward beneath the zygomaticus and zygomatic head of the quadratus labii superioris, descends along the anterior border and then on the superficial surface of the masseter, crosses over the body of the mandible and passes obliquely backward beneath the platysma and cervical fascia, superficial to the submaxillary gland, the digastricus and stylohyoideus. It unites with the posterior facial vein to form the common facial vein, which crosses the external carotid artery and enters the internal jugular vein at a variable point beyond the hyoid bone. From near its termination, a communicating branch often runs down the anterior border of the sternocleidomastoidus to join the lower part of the anterior jugular vein. The facial vein has no valves, and its walls are not so flaccid as most superficial veins. Tributaries. The anterior facial vein receives a branch of considerable size, the deep facial vein, from the pterygoid venous plexus. It is also joined by the superior and inferior palpebral, the superior and inferior labial, the buccinator, and the mesenteric veins. Below the mandible it receives the submental, palatine, and submaxillary veins, and generally the vena comitans of the hypoglossal nerve. The superficial temporal vein, venous temporalis superficialis, begins on the side and vertex of the skull in a plexus which communicates with the frontal and supraorbital veins, with the corresponding vein on the opposite side, and with the posterior auricular and occipital veins. From this network frontal and parietal branches arise, and unite above the zygomatic arch to form the trunk of the vein, which is joined in this situation by the middle temporal vein from the substance of the temporalis. It then crosses the posterior root of the zygomatic arch, enters the substance of the parotid gland, and unites with the internal maxillary vein to form the posterior facial vein. Tributaries. The superficial temporal vein receives in its course some parotid veins, articular veins from the temporomandibular joint, anterior auricular veins from the auricula, and the transverse facial from the side of the face. The middle temporal vein receives the orbital vein, which is formed by some lateral palpebral branches, and passes backward between the layers of the temporal fascia to join the superficial temporal vein. The pterygoid plexus, plexus pterygoidis, is of considerable size, and is situated between the temporalis and pterygoidis externus, and partly between the two pterygoidae. It receives tributaries corresponding with the branches of the internal maxillary artery. Thus it receives the sphenopalatine, the middle meningeal, the deep temporal, the pterygoid, mesenteric, buccinator, alveolar, and some palatine veins, and a branch which communicates with the ophthalmic vein through the inferior orbital fissure. This plexus communicates freely with the anterior facial vein. It also communicates with the cavernous sinus by branches through the foramen vesicae, foramen ovale, and foramen lacerum. The internal maxillary vein, venus maxillaris interna, is a short trunk which accompanies the first part of the internal maxillary artery. It is formed by a confluence of the veins of the pterygoid plexus, and passes backward between the sphenomandibular ligament and the neck of the mandible, and unites with the temporal vein to form the posterior facial vein. The posterior facial vein, venus fascialis posterior, temporomaxillary vein, formed by the union of the superficial temporal and internal maxillary veins, descends in the substance of the parotid gland, superficial to the external carotid artery, but beneath the facial nerve, between the ramus of the mandible and the sternocleidomastoideus muscle. It divides into two branches, an anterior, which passes forward and unites with the anterior facial vein to form the common facial vein, and a posterior, which is joined by the posterior auricular vein and becomes the external jugular vein. The posterior auricular vein, venus auricularis posterior, begins upon the side of the head in a plexus which communicates with the tributaries of the occipital and superficial temporal veins. It descends behind the auricula and joins the posterior division of the posterior facial vein to form the external jugular. It received the stylomastoid vein and some tributaries from the cranial surface of the auricula. The occipital vein, venous occipitalis, begins in a plexus at the back of the vertex of the skull. From the plexus emerges a single vessel, which pierces the cranial attachment of the trapezius and, dipping into the suboccipital triangle, joins the deep cervical and vertebral veins. Occasionally it follows the course of the occipital artery and ends in the internal jugular. In other instances it joins the posterior auricular, and through it opens into the external jugular. The parietal emissary vein connects it with the superior sagittal sinus, and as it passes across the mastoid portion of the temporal bone, it receives the mastoid emissary vein, which connects it with the transverse sinus. The occipital diploic vein sometimes joins it. End of Section 35.